Hello everyone, welcome back to my channel and welcome back to Journey to Medicine. If you're new here, my name is Dan Mack, I'm a first year medical student, and today we have a special guest, friend and fellow medic, Kat.
Hi guys.
Hello, how are you?
I'm alright, how are you?
Yeah, I'm alright, thank you.
Good.
So, for the boys and girls watching this, can you introduce yourself?
So my name's Kat, also Kat the Medic, if you've seen me on Instagram.
Yeah. Thanks down there.
So I'm on the course with Dan. I previously did a Bachelor of Medicine. Did I do a Bachelor of Medicine? Getting ahead of myself there. I did a Bachelor of Science in Biological and Medical Sciences, and that was a foundation year. So that was a 4-year degree. After I did that 4-year degree, I then did a Master's of Research in Translational Medicine, which was based on oncology and oncological medicines, pharmaceuticals. So, yeah.
Yeah, and I saw the other day you had exciting news about your Masters, about your research.
Yes, my research that I worked very hard for is going to be published. So I'm really excited.
That's amazing,
Yeah.
Well done.
Thank you.
So, just talking about your degrees, you've done 2, which is amazing.
Mm-hmm.
Very driven, obviously, now doing a 3rd.
Mm-hmm.
Do you think doing those degrees, have you gained skills or whatever that helped you in medicine, or does the knowledge help you in medicine?
Yeah, so I think obviously primarily the knowledge, you learn the basis, like the molecular and cellular basis of medicine in those 2 degrees that I did, and I kind of set the foundation for now doing this degree. I kind of know things in a little bit more detail than what's needed, but it does sort of allow me to have a better understanding of certain pathological processes, and also help me in terms of research papers, because in medicine, you know, not a lot of people realise you always have to be on top of research because things are always coming out and changing guidelines. And from that past degree, I learned how to read a paper, how to analyse a paper, interpret it, critique it. And that's been really useful, especially when it comes to this essay that we're currently writing. So, yeah, those are really valuable skills. I also learned lots of communication skills, team working, perseverance.
Definitely.
And then manual dexterity. Not a lot of people gained manual dexterity in my degree, but with some of the projects I was doing, it did require me to do dissections on very small organisms. I'm going to use that word. And yeah, I think that allowed me to work with my manual dexterity as well. And that's something that's really important in medicine, especially if you want to pursue a career in surgery, for example.
Definitely. So we'll come on to specialties in a bit, but I can see that surgery is all the answer anyway. So outside of your degrees, is there anything that you think particularly prepared you for medicine?
I think for me, it's especially the Masters prepared me in terms of I used that as part of my work experience.
Okay.
Because I got to work within an MDT, within that laboratory group that I was placed with, who I had been previously a few years before that. And that sort of got me to see how doctors aren't just the only person on a team. Like, it's the nurses, it is the people in the lab, it's the radiographers. There's so many people to a team, and that opportunity really allowed me to see that, and to see that doctors aren't just this sole person. Yeah.
Wow. Fair. I mean, fair enough.
And so you see how medicine and research go hand in hand. I don't think people see them as 2 separate things, whereas my project actually saw that crossover of patient samples coming to me, and then, you know, how I would process them and interpret them and whatnot. So I was really lucky to have that opportunity.
Wow, it sounds like an amazing opportunity. So yeah. So you said as part of the work experience you did, is there any other work experience you did then?
Yeah. So I'm sure, like you, for a long time I'd sort of toyed with the idea of being a doctor. And because of that, I decided when I was 16 I need to start getting work experience. So my first one was in a care home. I was there for about 6 months. And after that, another one I used was my volunteering. So I'm really passionate about volunteering and fundraising for especially cancer research purposes. So from the age of 16, I've been volunteering in Cancer Research UK shops, sort of contribute in some way towards raising money for them.
Wow.
Another one that I used was working Clark's.
Okay.
Really strange, I
different.
know. But with Clark's, like, it really taught me communication skills, because I was dealing with babies from about 3 months old having their first shoes or like little cruisers, and dealing with parents. That really was a skill in itself, being able to deal with parents, because understandably, you know, they're quite worried the baby's getting their feet measured and things like that. And then I was also dealing with teenagers, young adults, and then the elderly as well. And that really gave me the skills and the breadth of communication to deal with all range of ages. And also had to have that scientific knowledge, that medical knowledge about how feet develop and why it's important for us to fit shoes properly. And I know it sounds really silly, but
it's important. It's important.
Yeah, I definitely did gain skills about, you know, talking to patients about why we're giving them a treatment and whatnot, and sort of be able to fully explain my justification for certain shoes. So that was another one I used.
Wow.
Obviously used my research and my degrees. And then I was really lucky that my PI got me in contact with, well, she actually just gave me the emails. I was like, oh, do you happen to know any doctors who would let me shadow them? And she was like, yeah, here's some emails of people that I work with. And I was like, okay. There's like 20 people on this list. So I emailed every single one with a personal email, you know, telling them about how I want to be a doctor, etc. One of them replied out of the 20. And crazy. He was a cardiothoracic surgeon. So yeah, and he was so supportive. So when we first met, we had a little meeting, and he was like, you know, tell me about your experience up to this point. So I told him, and he was like, yeah, you sound perfect for it. So, right, do you want to come to surgery with me? And I was like, yes, please. So I was with him for about 2 weeks. So I would go to morning ward rounds at about 7:30. And then I'd go to clinic, and then I'd go to surgeries. I'd go to ICU, I'd shadow nurses, I'd shadow physios, because he really wanted me to get the idea of what being a doctor is like, or a surgeon.
That's brilliant.
And yeah, that was amazing. I was so lucky to get that opportunity, and not a lot of people can get that opportunity. And yeah, and that's all I had really. Like, as you can see, there wasn't really a lot of medical, but I made it work.
Well, yeah, like you just said there, not a lot of people can have the opportunity, but I liked how, like, you spoke about you working in Clark's, sorry, yeah, that's amazing, because like we did, like, obviously, if you guys are new to this channel, you would know, but we made a video about work experience, go check it out. And see, this is a great example of how you don't have to do medical work experience to reflect on it, because you're right, you're talking to a broad range of people, developing communication skills with all of them, different scenarios. It's amazing. I wish I thought of that. That's amazing.
Yeah. I was like grasping at straws. I was like, I've not got enough medical. I was like, however, Larks was a great one for medical kind of things. So.
Well, no, it's amazing. Seriously, right now I'm like, well, that's I could just read your personal statement, being like, how has she done this? This is fantastic. Like, so fair. So when you in your degrees, did you do any sport then?
Yeah. So I've been rowing since the age of 11.
Oh wow.
Yeah. So after high school, I decided I didn't have enough of rowing, but unfortunately, in the gap between A-levels and university, I got really ill and I had to stop rowing myself. But then there's another role within rowing called coxing. So essentially, you are the eyes, ears, brains of that boat, and you have to get a boat of up to 8 people to work together to achieve a goal. Again, that was another great thing about gaining skills for medicine, and I also used that in my personal statement and the work experience forms that we got sent, if you remember that way back when. So yeah, I did rowing for the whole time I was at uni. So I didn't do it for my masters, because I decided I wanted to fully dedicate my time for masters, but the 4 years, the bachelor's, I did it.
That's awesome. Yeah, fair. Yeah, I personally am a big advocate for sport being good work experience. It teaches all the perseverance, everything. You name it, it'll teach you that. So, great thing.
Yeah.
And in your medical application, clearly. So, yeah. Yeah, fair. So, now that you're in med school, what's been your best moment so far?
Ooh. There's been a lot, to be fair.
You can't say this interview, just later.
I think probably the best one is being complimented for my communication skills in our first ever clinical skills session. I think I interviewed a patient, and I think it was John. He was like, "That was really good." He was like, "I haven't got anything to say," and I was like, "Okay."
Wow.
And he was like, "Yeah, it just seems to come very naturally to you." I was like, "Yeah, I just like talking to people. I'm just very good at talking to people." Yeah. But then obviously there's a counterpart to that. There's a funny story where I messed up once. It wasn't communication. It was actually like a stethoscope thing. It was really funny. Okay.
Fair. I can just picture you like putting the bell on your head and being like, "Hello," with the ears.
It was similar to that. What did I do? I was trying to listen to John's pulse. I was like, "John, I can't hear your pulse." And he was like, "Turn it around. You've got it on the bell rather than diaphragm." I was like, "This is so embarrassing."
That's easily done. That's not as embarrassing as like singular. Fair. Sorry. I can just imagine you doing that. He's just like.
Literally, he was like, "Oh my goodness." This girl.
Easy done. I wore it backwards for ages, and I was like, "I can't hear anything." And like,
this is really uncomfortable.
Yeah, I was like, "They do this on Grays. It works." He's like, "This isn't Grays."
This is medical school.
Yeah. So what? Obviously, an obvious question. What? I don't want to ask because it's quite a precious question. It's a big question. What made you want to become a doctor then?
I did an Instagram post on this actually. Not sure if you saw it.
Yeah, it's one of your like second or third ones. I can't remember the exact number. I'm not that bad.
So it was when I was really young. Unfortunately, my grandma died of metastatic cancer, and they took her cells to be processed because they were doing some research at the time. And the next thing we find out is that they discovered the whole BRCA2, BRCA1 genes, and it turns out our family had it, which explained why my grandma and like literally all the women in our family had died of cancer. And then my mum had to undergo all the operations that would prevent her from getting the major cancers. And those are like my earliest memories. Like I really vividly remember, like, you know, she'd be going in and out of hospital for operations and whatnot. And she would just say to us, "Oh, I have to go get my grumpy bits out." And I was like, I don't know what that is. And like doctors would be talking to me all the time. And I think that was like my first ever exposure of doctors and hospitals. And I saw it in like this light of they're fixing my mum. Like, I want to do that. So whenever mum would be at home, I'd be looking after her, you know, giving her water, checking her heart and whatnot, you know, thinking that I was helping. And I think that was it, to be honest. Like, I had the bug, and that was it. And ever since then, I was obsessed. Like, my parents were like, ever since you were little, all you said was like, "I'm going to be a doctor. I'm going to be a doctor." So, yeah, I didn't know any doctors. You know, no one in our family's done medicine or nursing. I'm like the first one. So, you know, it was very strange.
Well, fair. So I imagine that drives you toward the
exactly.
You have now.
Because I always had in my mind, like, I don't want people to go through what I had to go through, or if they are having to go through like what I went through as a kid, like, I want to help them and like their families. So that's like my biggest driver, is, you know, wanting to help others when they're struggling, like at the hardest time of their life, really.
Wow. Well, that's some powerful stuff. So move on to more light stuff then. This question I like asking people because it puts them on the spot a bit. But if you were a Grey's Anatomy character, which one would you be?
Oh, I've got this one down.
Yeah?
People always tell me I'm like a Christina Yang, Meredith Grey hybrid. Like, I'm very driven. I'm, you know, I know what I want. And yeah, I just don't really take stuff, do I? Like, I'm cutthroat sometimes, but I'm lovely. But like, you know, I can be cutthroat when it comes to medical stuff.
I mean, that's a good answer. I mean, why not? You're clearly driven. You've done so many degrees. You're here now. Mashallah. You've already started the essay. I need to do that. So thanks for the reminder. Fair. So obviously medicine's difficult, as everyone knows. It's not easy. How do you find a balance in medicine then?
I think it's being organised.
Yeah.
So, when we get all of our lectures and stuff, I'll plan out when I'm going to do each one. And obviously I've got my set way of doing my lectures too. Like I'll be listening to it, just kind of doing some notes, doing some Anki cards. And then I'll plan, I'll know I'll work from 9 to 5 and I won't really work past 5 o'clock. So I'm just like, I'm too tired. Like my brain's just not going to take in that information. I'll have that one day off a week and make sure I'm exercising every day. Like just, looking after yourself as well. I think it's really important when it comes to balance. Like knowing when you are going to burn out. I think it's really important to know your body and know what you can do.
Definitely. Like when we first started, they gave us a lecture about how you have to plan time to speak to your parents or whatever, or to go for. I was like, I can phone my parents or I want to be on about. And now I'm like, okay, yes, every Thursday there's time we're gonna call.
Yeah. And don't look at what other people do either. Like everyone's different. I wouldn't look at how my housemates do their day because we work completely differently. Like I know what works for me, and I'll just stick to it.
Definitely. Like comparing is a bad idea.
It really is. Just don't do it.
Yeah, there's always someone better at you out there, so just don't look and be nice.
Yeah, focus on your own journey.
Yeah, exactly. Which kind of links on to the whole imposter syndrome. Obviously, for me, it was a big thing. I don't know about you, but is there any way you've found to deal with it?
I think it's just reflecting on what you've done to get to this point. Like you've worked hard, haven't you? You've just waltzed in, you have persevered, you have worked hard to get to this point, and you've always got to think they chose me.
Yeah.
Out of all those people that could have chosen, they chose me, and I'm here for a reason. And sometimes even just talking to your housemates about it, or your friends, whoever you live with, your parents, and just having those people remind you, be like, look, you've been through so much, and look at where you are. Of course, you deserve to be here, and you deserve to be here. You've just got to have that little reminder sometimes. But I do have days where I'm like, did they actually choose me? Was this a mistake? Do I need to email them and just double check that it wasn't another Catherine? No, everyone's gonna have imposter syndrome, aren't they?
Well, yeah, the one thing that got me through in the beginning, I think it was John. It could have been John, or it could have been Richard Webber from Grays, but they're both the same. It was like, med school, so they're the same, obviously. It's like med school is like when you're trying to get into med school, it's like climbing up a hill. You get to the top, and then you realise you're not quite at the top yet. So you have to go again and again. In terms of you need A-levels, entry exams, blah blah. And then med school itself is like being at the top of the mountain, and you don't recognise the view, so you're not quite sure if you're there yet. So I think for me, it's just understanding that you are here, like you said. Enjoy the view, enjoy it well. Soon you'll be an actual doctor, not a med.
Yeah, exactly. So, and this is just what 4 years.
Yeah.
We'll be at the finish line in a blink of an eye, and we'll be like, why did I even feel like that at the beginning? Look where I am. Yeah,
exactly. So just lastly then, two last things actually. Kind of an obvious one, I guess. But if you weren't studying medicine, is there anything else you'd be doing?
Biology related or completely different?
Anything. If you were to drop out of medicine today, what job would you do?
Oh, I'd probably go and do my PhD and continue with the research that I started in my masters.
Yeah, that's why I thought it was an obvious question, because you've obviously got a good master's going.
Complete opposite of that. I keep talking about this on social media, lol. I'd probably go and do Egyptology. It's always something that I've really had a passion for. It's really similar to medicine in the way of it's a mystery, you're a detective, you put pieces of the puzzle together to help someone, even though way back in the past. But I'd probably go do that. Because why not?
I guess. Yeah, why not? So then lastly, for people that are watching, being aspiring medics like we were back in the day, all those many months ago. Do you have any final tips for them?
Persevere.
Yeah.
You're going to hit some bumps in the road. Like, I didn't even get into uni first time round, and look at where I am today. Like, I'm in medical school. And just remind yourself why you want to do it.
Yeah, that's great advice. So thank you very much.
You're very welcome.
I guess lastly, I keep saying lastly, but lastly, if people have more questions for you, where can they find you?
So you can find me on Instagram. So Cat the Medic. Yeah. My DM's are always open. I'm always on my phone, so I'll definitely see it and I'll definitely reply.
Fair. I'll leave a link below. Everyone go check her out. Thank you so much for being with us today.
And thank you for interviewing. Hopefully we've helped some people.
Definitely. You definitely inspire people, so thank you.